Pregnancy-induced hypertension and preeclampsia have not only affected Ghanaians, but people all over the world. So we'll be looking at the general overview of hypertension, the risk factors that are involved in pregnancy-induced hypertension and preeclampsia. Then we'll look at preeclampsia and pregnancy-induced hypertension in details. We'll look at how women are at risk. Then we'll look at the complications. Then we ask ourselves, what can we do about it? So pregnancy-induced hypertension is our main concept, but what is hypertension? In the Icon Health book, which is An Edge to Resilient Health, together with the WHO definition and everything, we define hypertension as the blood pressure that is above 140/90. Now, new recommendations are even coming that we should use 130/85, which shows that before even your blood pressure goes beyond the normal level, it is detected that it is rising. So when your blood pressure is severe, which is above 180/120, now we are looking at 160/100, even as very, very severe and dangerous. Then that means you are capable of developing complications such as stroke or even dying from the blood pressure. So in simple terms, blood pressure is a force with which blood flows. Everybody has blood pressure because everybody's blood flows with some kind of pressure. So the only thing is when it becomes too high or too low, then it becomes a danger to the person. So hypertension is one of the leading causes of morbidity and the mortality rate in this country and the world at large. The rate at which individuals are getting high blood pressure complications is becoming very alarming. That is why it's necessary for us to do something about it. Now, risk factors of hypertension could involve the age of the person. Okay, people who are aging, it could affect or it could make your blood vessels more less elastic. That means exposing you to the complications of blood pressure. Genetics, sex, and ethnicity are also part of the non-modifiable risk factors. These ones we cannot do anything about. We say men generally have high blood pressure than women, but when pregnancy comes in, the statistic changes. When menopause comes in, the statistic changes. That is why we are saying sex. During a time in one person's life, they may be more prone to high blood pressure. In another point in time, the other sex may be more prone. So, but in general, without looking at age groups or without looking at points in life, in general, men are at risk. But when women are undergoing pregnancy, delivery, after delivery, or menopause, they become more at risk. Ethnicity. We realize that Blacks are more likely to develop complications of high blood pressure than Asians of Caucasian groups. And this might be due to our choice of foods. You know, in Ghana especially, we like more spicy foods and we consume more salt, more artificial spices, which is now becoming a big problem for us. Now, the issue is these are things we cannot do much about. Your age, your genetics, your sex, your ethnicity, we cannot do much about it. But how about things that we can do something about, like the body weight, the salt intake, the level of exercise, smoking, and other things, activities, modifiable lifestyle activities that we can do something about. There are also risks that can be managed. So we are going to focus on what we can do much about, which is the modifiable risk factors. So it's there for you. Sometimes you are going through a lot, but the the consumption of food or the things that we consume more may lead us to develop obesity. Sometimes your genetics can also lead to develop obesity, but you can do something about it. It can be managed when you look at it. You can visit your dietitian in Icon Health Clinic and receive a food plan to manage obesity. During pregnancy, you realize that people develop high blood pressure. Now, when you are aging in menopause, you can also develop high blood pressure. Smoking and use of drugs can lead to high blood pressure. Even the post pill that women take, when you take it too often, you are what's the name? You are putting yourself at risk of developing high blood pressure. Then drinking alcohol is also likely to lead to high blood pressure. Then now let's go forward. No, so the question is, pregnancy changes a lot about a woman, including her heart. But how does this play out? Okay, the heart of a pregnant woman works harder as compared to that of a woman who is not pregnant. This is because the heart of a woman, of a pregnant woman, is now forced to supply to greater body mass as she has gained weight. And also, not just supplying blood to herself alone, she's supplying blood herself and the baby, the unborn baby. So these changes can lead to a woman developing high blood pressure. Preeclampsia and PIH in women, as we are continuing. Blood flow to the breasts and skin increases during pregnancy. And all these put a lot of strain on the heart. These demands may lead to a rise in blood pressure, especially in the last trimester of the woman. So that we know this, what then can we know about preeclampsia itself? When we say preeclampsia, we are talking of rise of blood pressure in women, but this time it's associated with leakage of proteins, that's proteinuria, in the urine. So when there is leakage of protein into the urine of a person, when you do your urine test and you see a lot of protein inside during pregnancy, and you see that the woman has high blood pressure or the blood pressure is above 140/90, then you are beginning to suspect that preeclampsia is resulting. If BP rises in pregnancy without proteins, then that means that it is called pregnancy-induced hypertension alone. So when it is with proteins in the urine, then it is preeclampsia. So let's get the differences right. Blood pressure is not managed early. It can have effects on the kidneys. In the case of proteinuria in preeclampsia, it is characterized by reduction in renal perfusion and damage to the glomerular basement membrane, resulting in leakage of proteins in the urine. So, in short, scientifically, this is easy to understand. So damage to any membrane will result in leakage. So when there is damage and there is problem in the kidney, there can be leakage of proteins into the urine. This means that preeclampsia is resulting, okay, and it can be managed. So preeclampsia occurs in 3 to 7% of women who are pregnant in their 20th week of pregnancy, and usually before the end of the first week after delivery. With pre-existing high BP, women with pre-existing high blood pressure are 6 times more likely to develop preeclampsia. So if you're a woman who is preparing to even give birth, you have to be checking your blood pressure. when you go to the hospital, or there's a pharmacy near you, or you can consult Omron to get an Omron BP machine to be checking your blood pressure often, so that you know whether you are at risk of developing high blood pressure during your pregnancy. So any woman can be at risk of preeclampsia. However, women that have higher risks are women who have not put to bed before. The women who are nulliparity. You are a woman, you have not given birth before, you are at risk of developing preeclampsia. And when preeclampsia is not managed early, I tell you, it can lead to death. So it's very necessary that you identify your risks and you work on it. Okay, those who have experienced preeclampsia before are likely to experience it again. Then women who have family history, maybe your mom or your close relative have developed preeclampsia before, or high blood pressure before, you are likely to develop high blood pressure. So it's good to take precaution. Now, sometimes it can also be due to stress or some other thing. If you have a new partner, scientifically, we realize that women with new partners, different from the father of other children, are at risk. Prolonged pregnancy, when your pregnancy lasts beyond 9 months, is likely to develop into preeclampsia. Then obesity in women, as we saw, obesity is one great risk factor of hypertension. So it can also lead to preeclampsia. Women who drink or smoke are likely to damage a lot of organs in their bodies. And these can have effect on the kidneys, and this can also result in preeclampsia. Increasing maternal age, as you get closer to menopause, when you get pregnant, you can develop preeclampsia. It's better to give birth earlier before the menopause. Okay, but in case you are planning or ready to give birth near menopause, it's just better to take precaution and to seek for medical attention so that we can prepare you to prevent preeclampsia. If you have pre-existing hypertension, you have the likelihood to develop preeclampsia. Women with diabetes have the susceptibility of developing preeclampsia and even severe organ damages. So it's good to check with the diabetes status and also put it into check. Women who have multiple babies in their womb are likely to develop high blood pressure and preeclampsia. So if you have twins, you have triplets, you have quadruplets in your stomach, in your womb, it's better to check and be consistent with your medical checkup to prevent preeclampsia. Now, complications of preeclampsia. Preeclampsia is usually without symptoms. It's like hypertension, no, it's silent, but it can result in premature detachment of the placenta from the uterus. So usually in preeclampsia, we usually carry out CS, getting to the gestation period, getting to the delivery period, so that we can, prevent this from happening. Then babies born by women with this condition can develop problems such as small birth weight, jaundice, undernutrition, among the lot. So birth deformity, sometimes developmental delays and Down syndrome, all those things can result when you have this condition, when you have preeclampsia. Preeclampsia can also generate into eclampsia. Eclampsia is like stroke, when there's so much damage and then there's seizures and, a lot of things happen. A woman's system can rupture and then she can bleed, and then this can lead to death or serious complications. Now, we have the HELP syndrome. HELP syndrome is hemolysis, which means that there is breakage of red blood cells, and then there is elevated liver enzymes, which is a sign that the liver function is compromised, leading to low platelet count. Platelets help with the clotting of the blood. So when there is low platelet count, and then that means the person is at risk of at risk of excessive bleeding. So preeclampsia can progress into this HELP syndrome. So it's better to prevent preeclampsia when you notice it at the early stages. Okay. Then women can develop swollen feet and hands, dotted skins, and then headaches that can be relieved with paracetamol, distorted vision, confusion, abdominal pain, vomiting, and difficulty in breathing. So these are some of the symptoms that are associated with preeclampsia. I'll let the dietitian take us quickly through what we can do. So Pamela is going to take us through what we can do as interventions or ways to prevent preeclampsia and pregnancy-induced hypertension quickly. Thank you.
Good evening to you all. My name is Pamela. I'm a registered dietitian at Icon Health Clinic. So I'll be taking us through the interventions and how we can go about management of preeclampsia and pregnancy-induced hypertension. So the best way to prevent or manage high blood pressures in pregnancy is by early detection. As we said earlier, preeclampsia doesn't really come with symptoms. So, and also in the second trimester of pregnancies, the pregnant woman's blood pressure is normally dropped low, and then their blood pressure begins to rise in the third trimester. So it is always essential for the pregnant woman to be in the known of her blood pressure levels. That's by checking it regularly, going for maternal checkups regularly. You can also get the equipment at your home and then be checking your blood pressures normally. When you check your blood pressure and your blood pressure is high, it is advisable to consult your medical professional, your doctor, or anyone that you know before you can go in for drugs. Because most of the times, the drugs that, the antihypertensive drugs that are being given to pregnant women come in different milligrams. So if you try to self-medicate yourself, you are going to put more harm to yourself. So with the medical management of preeclampsia, it normally comes in two folds. When the blood pressure is not really high, you can be given some medications such as nifedipine and even labetalol to be managed. Then you'll be released to go home and then be coming to the hospital for regular checkups. But when your BP is extremely high, with that one, you have to be taken into the hospital for regular monitoring so that your BPs can be kept and then managed for you. So, like I said earlier, when your BPs are too high, don't self-diagnose yourself, but consult your physician first. Then continue with the dietary intervention. So most of the times, the choices of food we take in have a lot of effects on us. And so if we try to, or if we learn to control what we eat, and then how often we eat, and then when we eat, as well as how much of what we are eating, it can significantly improve upon our health. In managing high blood pressures in pregnancy with diet, it doesn't really go the same for everyone. This is because the severity of someone's illness is mostly different from what someone else is feeling. For example, my blood pressure, if for instance I'm pregnant, my blood pressure may be 160 thereabouts, and someone else's own will be 120. The management doesn't come the same for everyone. It comes in different ways. So in managing someone with preeclampsia with diet, it comes in different ways. The person has to be assessed. That is, their anthropometry has to be taken, their biochemical has to be checked, their diet history has to be checked. Then they plan a meal and then also a diagnosis for the person. So it's not the same thing that's run across for everyone. But then some of the important things that we can adhere to help us prevent high blood pressures in pregnancy, or also manage high blood pressure in pregnancy. That is when we have it. is first of all by reducing the consumption of excessive excessive sodium and sodium-rich foods. Some sodium-rich foods are the canned foods we eat, and even the salt we eat. And in our Ghanaian normal eating, we call this salty fishes such as kobe, the momoni. Normally, when you take it excessively, it contains a lot of sodium, which is going to raise your blood pressure levels. And sometimes taking in too much sodium can make you get edema. So it is essential for us to reduce the excessive salt that we take in. Also, it is essential for us to reduce the quantity of canned foods and spicy foods that we take in. Too much spicy foods, that like the seasonings that we use in our food, contains sodium and other preservatives. This sodium are mostly kept in our food for it to be preserved for a long time. So taking in too much into the body can raise our blood pressure levels and also go a long way in harming us with giving us kidney problems. And also reduction in the consumption of saturated fats, trans fat, and high cholesterol diets. Reduction in the consumption of saturated fats, the trans fat, and then the high cholesterol diet also contributes to us managing our BP levels. So this saturated fat normally when consumed raise our BP's levels. So it is essential for us to reduce them, the trans fat. Limit the consumption of caffeinated foods and beverages. Too much caffeine puts you in stress. Times that you are supposed to rest, your body still is awake, so you don't get time enough to rest. And this puts a lot of strain on the heart, making us overweight and then thereby increasing our BP levels. So it is essential for us to reduce the quantity of caffeinated foods that we take in within the day. We should also choose fresh foods over processed foods, then increase the consumption of potassium-rich foods, but you should also take into consideration your lab results. That is why it is important for us to always go in for medical checkups, knowing your lab results, because if your potassium is too high and then you take in too much potassium food, so it can harm you, then you increase your consumption of high fiber foods such as fruits, vegetables, nuts, seeds, and legumes. Then you use monounsaturated fatty acids and polyunsaturated fatty acids instead of the saturated fatty acids. Then you adopt other cooking methods such as frying to reduce the quantity of oil you are consuming within the day. So you can go in for other methods such as grilling, such as boiling, poaching, steaming, and stewing rather than the frying. So we move on to exercises. Exercise really helps us, and then some of the benefits of us exercising helps us to reduce our BP levels by 10 to 20 millimeters per mercury. And then it helps reduce your HDL cholesterol, which is your good cholesterol. And it increases your HDL cholesterol, which is the good cholesterol, and lowers your bad cholesterol, which is the LDL. It also releases stress, which is a precursor of high BP, and then reduces your weight and also reduces the fat constituents in your body, thereby handling obesity, which is and its associated problems, which are all risk factors of preeclampsia. So as a pregnant woman, some exercises that you can engage in include walking or brisk walking. You can dance if you can. You can do stair climbing. All of these are all exercises. And within a day, you are supposed to exercise within a week, you're supposed to exercise for 150 minutes. That could be like 30 minutes for 5 days in a week. So it is always important to practice meditation as well, and also take time to rest in order to relieve stress and to also help you lower the risk of preeclampsia and pregnancy-induced hypertension. So this is just a footnote. You should always remember knowledge is power. Let's try to take our health serious and be responsible for our own well-being and that of those around us. Thank you very much. Please, any questions?
Thank you very much, Pamela. And it's good to have that wonderful education. And now I know that we all know what we can do for prevention and management. So now let's talk about contributions, questions, and if you have an experience in this issue, maybe you have had an experience, you have been a pregnant woman before, or you have been a clinician that has managed it and you want to share with us.
Good evening to everybody once again. I would like to appreciate Dr. Nelson and Pamela for such insights, and the fact that the topic presented is very, very relevant today. It is very crucial. It is very critical. It is an urgent topic. I've had, is it 2 people or 2 friends, close people die from preeclampsia. In February, one of my closest friends almost died from it as well, but there was an intervention, and she's there now with her precious little baby girl. Yeah.
Wow.
It is critical. Yes, she didn't think it was anything serious. I think at 33 weeks or below, she started experiencing preeclampsia, and she was relaxed about it, you know. So when I got involved, I told her I didn't even give her the urgency of it too. Otherwise, everybody has their various ways of managing themselves when they hear certain information. And knowing her, I decided to be checking up and finding out about the information she's getting from her doctors and everything. At a critical time, I decided no. I went to pick her myself, took her for second opinion. I made the monitors be around her for her to see where she is. And at that point, the baby, who is supposed to be 38 weeks, was 35 weeks.
Wow.
Meaning for 3 weeks, baby wasn't growing. Baby was gradually dying. And it was going to have 3 weeks. And we had to section her and delivery quick. So it is a very important subject. In Ghana, we lack information, and I thank ICON Health now to push out some of these important information. People die because of lack of information. People aren't supposed to die, but because they don't know about it, they take things for granted and they die just like that. So and now to say a few things. Let us be intentional about our health. Very intentional and deliberate. Yeah. And put whatever resources to our health to stay alive, to impact our wealth. So thank you, everybody.
Thank you very much, Dr. Bibi. God bless you for your contribution and for sharing those experiences. God bless you for also supporting the ICON Health in many ways. Thank you all so much. You can also contact directly any of us that's on the website. You see our numbers there. You can contact. You can also come to the ICON Health Clinic at Pokufama, Taifa. Just come to Taifa. You type Pokufama building. You will see us there, right opposite the Pokufama building.